So this is Dr. Mark Skeen again, talking about issues related to multiple sclerosis. The topic of this video is diet and multiple sclerosis, and it'll probably be controversial. That's all I can say. But in any case, let's talk about it. So when I talk to my patients about diet, I often make a lot of jokes, and I will today as well. But for the most part, I don't know what to tell them. There's a lot of information on the internet suggesting that all sorts of diets are useful in MS, and tremendous anecdotal reports of benefit, most of which have very little scientific background or data to suggest that there's truth embodied there. I want to tell you a little bit about why that's the case, and just make some sort of philosophical observations. What I would say is we have very little scientific evidence that anything that is in our diet makes a big difference in multiple sclerosis, in getting multiple sclerosis, or in impacting the course of multiple sclerosis once we have it. Now, I hope that's not true, and I would love to tell you something differently, but at this moment, in October 27th, 2017, I think that's the fairest statement. And I'll make a few exceptions and caveats. So the other thing I would say is that most of what is said about diet and its influence in our immune system is pretty superficial. In MS, your immune system is not underactive or overactive. It doesn't need to be modified, in a sense, up or down. But the problem is it's misdirected. And so things that stimulate the immune system or have some inhibitory effect may or may not really influence the part of the immune system that's gone wrong in multiple sclerosis. So it's not as simple as eating something that's pro-inflammatory or anti-inflammatory. And most of the statements about pro-inflammatory or anti-inflammatory foods have a little basis in truth, but very little magnitude of benefit or efficacy. I wish that was not true, but that's what I believe is the truth. The other thing I'd like to say is the lack of evidence that changing diet affects MS very much doesn't mean it can't. It's very challenging to do good nutritional research. We have decades and decades and decades, and nobody tells the truth in a research trial about what they eat. I don't tell the truth. I was asked, probably. So it's very challenging to make a scientific evaluation of changing a diet in a large number of people and know that you've actually done it, and therefore know that some impact makes a difference. And all of the retrospective studies that have been done on diet, like studies about the Mediterranean diet and various things, have just been fraught with errors in terms of their scientific validity. I don't know how to say it any other way than that. So the other thing I would say is that if I was going to design a human being, or any animal for that matter, with a very complicated immune system, the last thing I'd want to do is have the function of that immune system depend very heavily on what that animal or human being ate. I mean, that could be a tremendously dangerous circumstance, to have an immune system which was so fragile that its effectiveness would depend on our diet. I think that organism might not survive too well. And So I'm concerned that when we look to diet, either philosophically as a source of therapy or based on evidence, there's very little evidence that it makes a difference. Now, years ago, I've told a bunch of my patients that I was going to write Dr. Skeen's Cake and Ice Cream Diet book. I never wrote it but I figured it would be as good as any other diet in terms of efficacy, and we'd all be happy, and I'd make a lot of money selling the Cake and Ice Cream Diet book. The truth is, I'd love to prescribe a particularly effective diet for MS. I'd much rather use a diet than these therapies that affect the immune system. If the diet worked, we just don't have evidence that it does. So I want to make a few other observations. So there's a lot of research at the moment on the gut microbiome, and this is going to be a very short and inadequate description, but what you need to know is there is a whole immune system in our gut, in our intestines, and the tissues draining our intestines that for years we didn't know much about, but it's very elaborate. It has all sorts of influences on our whole immune system. And it's influenced a great deal by which bacteria and other organisms live inside our intestines. And we are only beginning to understand a lot of those aspects. There's a great deal of research going on connected with MS and otherwise, and it may be that we're going to learn some tremendous secrets about how the specific bacteria that are in our gut and the foods we eat do influence our immune system, and hopefully have some valuable treatment results from that information. So it's very promising. It may make what I've told you earlier complete nonsense, and I hope it does. And we're looking forward to those advances. The two other things I think I should talk about in discussing diet and MS specifically are vitamin D and biotin. So first, let's tackle vitamin D. So there's a tremendous amount of information that suggests that low vitamin D levels are much more likely in people who have multiple sclerosis. And the inverse is true. It's much less likely to have multiple sclerosis if you have higher vitamin D levels. And that even in those folks who have multiple sclerosis, the amount of disease activity may correlate with the vitamin D levels. And that has prompted a lot of recommendations about supplemental vitamin D in MS, and we certainly do recommend it as well. There's also a lot of understanding now. There wasn't when we first made these observations about vitamin D, but a lot of understanding now of how vitamin D impacts the immune system and other things that could influence the multiple sclerosis. What I would say is that using vitamin D to fix multiple sclerosis has been a little disappointing. So the trials in which we've tried to elevate people's vitamin D levels by supplementation and show that those people did better than they would have had we not given extra vitamin D have been disappointing. I don't know that it's conclusive, but at this moment, I would say it still feels a little disappointing. So we still recommend that essentially everybody with multiple sclerosis take extra vitamin D, and our general recommendation is 2,000 units a day. More is okay if you're particularly low, and so for a lot of folks, we measure vitamin D levels and try to get them into the high normal range of vitamin D over time, recognizing that it takes months and months of supplement to get to those levels. How much impact it's having is unclear, but it's very inexpensive, very safe, and therefore it's our judgment that the risk or the drawback is very low, so we recommend it. Biotin is a B vitamin that a lot of folks take to strengthen their hair and nails. It has recently been suggested, and studies reported to suggest that very high doses of biotin have caused folks with progressive multiple sclerosis to improve. My summary of that data is that it's not been thoroughly published, and as it's been reported in the press in various places, it's not always been clear exactly what was done, and it makes me somewhat suspicious that that finding is real. I hope it is. It's a tremendous finding that we could give a vitamin that would be more effective in a particularly refractory form of multiple sclerosis, primary progressive multiple sclerosis, for which in the past we've never had therapies that we could show benefited at all. So it would be a tremendous breakthrough if very high doses of biotin are effective in the treatment of multiple sclerosis. I hope it's true. I'm suspicious that it may not be, but we anticipate a well-done clinical trial that hopefully will begin later this year. So hopefully we will have very good information about the utility of adding biotin. The doses that were given in the clinical trial were 100 to 300 milligrams a day. That's a challenge in general because the highest regularly available dose in pill form in this country is 10 milligrams. So it takes a lot of pills each day or a compounded capsule to get such a high dose. So in short, what dietary advice do I give my patients? Well, I tell my patients I'd recommend a healthy diet. Just because they have MS doesn't mean they can't get heart disease or diabetes or some other condition. And there are conditions for which we know diet makes a big difference. And so what a healthy diet is appears, in my experience, to change every few years, unfortunately. But I'd recommend a healthy diet and probably supplementing with vitamin D. And the question of whether we should supplement with biotin is pretty unclear. So that's the best information. I hope we have greater dietary insights in the near future. But thanks.